It's a technology that uses computer guidance to help us use a bronchoscope to find lesions in the lung. Typically, a bronchoscope has a camera on the end, so when we put it into the windpipe, we can see the main windpipe and some of the big airways. But the problem is that most tumors are farther out into the lung, and we can't get there with just a camera. So even though we have an ultrasound bronchoscope, that only looks at things surrounding the windpipe. The computer guidance system, or the GPS technology, creates a virtual image of the lung based on the X-ray evidence. And then when the camera on the bronchoscope is connected with the computer, that helps us to navigate out through the lung to find the tumor out in the periphery of the lung. So the computer guidance is kind of like the GPS in a car. It tells us turn right, turn left, go up, go down, and then tells us when we're at the target. And once we're there, we can then do many things like take a sample or do a biopsy, or we can leave a little tiny piece of gold. It's called a fiducial marker that's used to help guide radiation therapy. Some patients, for whatever reason, really are not good candidates for the more traditional approaches. For example, a needle biopsy that goes through the skin under CT guidance. That has potential problems and complications, and if a patient has severe emphysema, for example, that may not be a good option. So going through the windpipe to get to the tumor is a better approach. We need a diagnosis, and this is a good way to get the diagnosis.